Introduction to Human Disease and Introduction to Pathology. What is disease? Disease, structural or functional change in the body that is harmful to the organism. Occurs when cellular environment changes to such a degree that tissues are no longer able to perform their function optimally.
Cataracts. Crystalline lens of the eye undergoes degenerative changes, becomes cloudy, obstructs the passage of light and causes decreased visual acuity. Occurs over time. Diabetes. Extracellular tissue of blood vessel walls undergoes changes that lead to narrowing of blood vessels. This leads to decreased blood flow, decreased oxygen delivery and eventual irreversible damage to tissues such as the retina, skin, heart, and kidney. Cancer. Mutations accumulate in the nucleic acids of cells which result in the distorted function and structure of proteins. This affects the way the cells interact with or react to other cells, growth factors, hormones, and the extracellular matrix of the environment. Pancreatic cancer. Multiple sclerosis, destruction of the protective myelin sheath around axons in the brain, which results in decreased electrical conduction. Signs and symptoms include weakness, double vision and incoordination. Cellular basis for disease. With the Enlightenment, people began to look at workings of the body in a scientific manner. Scientifically oriented doctors formed idea that disease is not caused by an external force that takes possession of the body, but arises from organs and tissues and leaves visible traces there. Clinico-pathologic observations. Physicians gained insights by closely observing the course of disease on a patient's body. Concluded that diseases can be traced to deranged structures or functions of organs, tissues, or cells, has been extended to molecular level of proteins and genes called allopathic medicine, biomedicine, Western medicine. Pathology definition. The study of disease includes the basic structural and functional changes associated with disease, the study of causes that leads to these changes, sequence of events that leads from structural and functional abnormalities to clinical manifestations. Etiology definition. The study of causes, the cause of disease. Involves environment, vectors, host, pathogen. The disease paradigm, simplified. Host, pathogen, environment triangle. Subdivision of pathologists. Experimental pathologists, scientists spending most of their time in research, investigate cause and mechanisms of disease. Jobs include research and teaching.
Anatomic pathologists perform autopsies, examine all tissues removed from live patients, and examine cell preparations to look for cancer cells. Includes autopsy pathology, surgical pathology, cytopathology, molecular, DNA, RNA, diagnosis. Clinical pathologists analyze various specimens removed from patients, such as blood, urine, feces, spinal fluid, or sputum for chemical substances, microorganism, antigens and antibodies, nucleic acids, atypical blood cells, and coagulation factors. Includes chemistry, microbiology, hematology, blood banking, immunopathy, molecular diagnosis. Manifestations of disease. Symptoms, evidence of disease perceived by patients, i.e. pain, lump, diarrhea. Health practitioners elicit these during an interview with the patient and record them in the patient's chart as the history. Signs, physical observations made by the person who examines the patient, i.e. tenderness, a mass, abnormal heart sounds elicited and observed during the physical examination. Results are recorded in the patient's chart. Laboratory findings, observations made by the application of tests or special procedures, x-rays, blood counts, biopsies. Diagnosis. Assimilating the information from patient's history, physical examination, and laboratory findings to identify the condition causing the disease. Also refers to the name given to the disease, i.e. diabetes, multiple sclerosis. Structural versus functional disease. Structural disease is also called organic disease, characterized by structural changes within the body, called lesions. Lesions can be visually identified with molecular medicine and technology. They can also now be identified at the molecular level of proteins and genes. 3 broad categories: genetic diseases, degenerative and inflammatory diseases, hyperplastic and neoplastic diseases. Genetic diseases caused by abnormalities in the genetic makeup at the chromosomal or genetic, gene, level. Developmental diseases develop during embryonic or fetal development. Range of abnormalities vary. Broad deformities can be preset at birth, Congenital abnormalities, biochemical changes caused by genes but influenced by the environment can appear later on, i.e. diabetes. Degenerative and inflammatory disease. Caused by forces or agents that destroy cells, or intercellular substances, deposit abnormal substances in tissues or cells, or cause the body to injure itself by means of the inflammatory process. External agents of injury. Chemical substances and microbes. Internal mechanisms of injury. Vascular insufficiency, immunologic reactions, metabolic disturbances. Direct effects of injury: necrosis, if cells are killed in injured area. Sublevel cell injury, if injured cells are capable of recovery. General reactions to injury: inflammation, a vascular and cellular reaction attempts to localize the injury, destroy the offending agent, remove damaged cells and other materials. Repair: replacement of damaged tissue by new tissue greatly influenced by the type of tissue or organ that has been injured. Functional diseases: diseases in which there are no visible lesions, at least not at the onset of the disease. The basic change away from homeostasis is a physiologic or functional one. More common functional disorders: tension, headache, functional bowel syndrome, hypertension, mental illnesses. Causes of disease. Exogenous, agents causing injury acting from outside the body. Direct physical injury is called trauma. Physical agents causing disease include heat and cold, electricity, atmospheric pressure changes, radiation, electromagnetic and particulate. Chemical injuries subdivided into the manner of injury: poisoning, accidental, homicidal, or suicidal. Drug reactions: toxic effects of prescription or proprietary drugs taken to treat disease. Microbiologic injuries usually classified by the type of offending organism: bacteria, fungi, protozoa, viruses. These are called infections and diseases caused or infectious diseases. Endogenous diseases, acting from within the body. Vascular diseases: obstruction to blood supply to an organ or tissue, myocardial ischemia caused by arteriosclerosis, hemorrhage, ruptured abdominal aortic aneurysm, altered blood flow. Microvascular changes in diabetes or hypertension. Immunologic diseases caused by aberrations to the immune system. Failure of the immune system to work equals immunodeficiency disease. Overreaction of the immune system causes allergic or hypersensitivity diseases. Abnormal reaction of the immune system to substances that the body produces equals autoimmune diseases. Class time work on the body systems poster, due Monday, February 9th. No exceptions when finished work on. Emergency room report in your medical terminology packet, due Monday.